The Prime Minister David Cameron visited a surgery in Bedford today where doctors are already putting into practice the kind of measures he wants to see adopted across the whole of the NHS.
Under the new plans, GP practices will be handed the power to commission NHS services. But the reforms have already come in for criticism. Medical charities doubting whether GPs have enough experience to take on the work of primary care trusts and strategic health authorities. Emma Baker reports.
You might not think a trip to the doctors is the ideal start to your day, but this morning the Prime Minister was keen to put local healthcare at the top of his agenda. His visit to Pemberley surgery in Bedford comes just days after the unveiling of new government plans to scrap local health authorities, all designed to give power back to the GPs.
How much stress will this new system put on GPs, and how many appointments, for example, will they lose doing their admin?
Well, I think the most important thing is to recognise we're putting the general practitioner, the GP, in charge of the health service. I think all of us, we know who our GP is and we trust them to do the right thing for us in the NHS. We don't know all the bureaucrats and the primary care trusts and the rest of it. So let's actually put the trust and the money and the power with the GPs. They should be the gatekeepers for the NHS.
This surgery has already made a step in that direction. It's one of 26 Bedford surgeries that work together in a consortium to gain greater control over how their money is spent. The head of that group is one GP who welcomes the government's new proposals.
Hopefully, it will enable us to sort of bite the bullet and really deliver healthcare that is better for patients, more cost effective and safe as well.
Well, those at today's visit backed the health reforms, that doesn't reflect the views of everyone in the region. Speaking on last night's Anglia Late edition, Luton MP Gavin Shooker criticised the government's proposals.
What this is, though, is the 9th reorganisation in as many years of the NHS. I think it's a really backward step at a point when the NHS is really starting to motor.
During his trip, Mr Cameron had a chance to speak to staff and patients. For the ladies on reception, the unexpected visit made for an interesting day at work.
We were very surprised. We knew that we had an important visitor today, but it wasn't until about 11 o'clock we knew who it was going to be, so it's very, very exciting.
Well, I actually came into work not knowing any of it, and just came into all the security about and everything, and walked through the door and saw David Cameron sat in there and thought, oh, it was a bit nerve-wracking actually walking into that.
The Prime Minister's visit today is all about talking to people at the grassroots ahead of what could be one of the biggest shake-ups the NHS has ever seen.